And thank you for joining us. For those of us, we have a full group here in Wauwatosa at the Community Conference Center, and we have some folks joining us online. So welcome to those of you that are online. We are excited tonight to be a part of the community education program here at Freighter. My name is Cindy Huber, and I'm with the National Kidney Foundation of Wisconsin. So we're a statewide health charity, and we do a variety of educational programs throughout the state of Wisconsin. And this is an example of one of those programs to create awareness for individuals just like you that are interested in kind of the connection between your kidneys and your body, if you will, and those kinds of things. So thanks for your commitment tonight to be here. We're very excited tonight to welcome two presenters tonight. And we also have another technical expert in the room, one of our former and current volunteers. So we're excited that we have three experts in the room. We're assisted tonight in terms of our program, in terms of the technology. We have two great National Kidney Foundation volunteers, John Hacker, who is in the back of the room here for those of you in the room, and Merle Steelman, who's monitoring. For those of you who are online, he'll watch for any of your comments or questions. The folks in the room are currently dancing right now on the tables, and I'm going to ask them to sit down, but when they shout out their questions, they're going to just shout them out so anyone online will be able to hear. But just in case they don't get to the decibel 10, our speakers will repeat the question. So for those of you online, you'll be able to hear the question and the answer. So again, we're excited to welcome Angie has volunteered with us, as has Olivia on several occasions, and Catherine. On many occasions, we also, another aspect of our organization is we do free screenings in the community for especially trying to reach people that have diabetes or high blood pressure and may not have access to some clinical care. And trying to get them connected to clinical care. So we've been very fortunate that our three experts today have volunteered with us for a very long time, and so we're honored that they're giving their time tonight. So again, I'm so excited to have Angie and Olivia join us today to begin our program on safe medicine use and keeping your kidneys healthy. So welcome.
Thank you, Cindy. Hi, everybody. My name is Angie. Just testing out. Can you guys hear me okay? Okay, perfect. And this is Olivia, and we are actually fourth-year pharmacy students who are going to graduate in May. So wish us luck. We go to Concordia University in Mequon. And so we're here today to talk to you about how to keep your kidneys healthy by using over-the-counter medications in a safe way, okay? And we just wanted to acknowledge Dr. Garabia, and she's actually right here in the front. She did this presentation in the past, and we used a couple of her slides for our presentation today, so thank you. Some learning objectives for today is we wanted to ask you guys, what do the kidneys do and why they're important to your health? So by the end of the presentation, hopefully you should be able to answer that. What is kidney disease and how do you get tested? And what are the causes of kidney disease? How do over-the-counter medications, pain medications specifically, cause kidney disease? And how can you prevent that from happening? And who do you talk to if you have any questions? And after we're done presenting, we will leave a couple, probably maybe 30 minutes for a Q&A session for anyone who has questions, okay? So what are kidneys and what do they do? So the kidneys are two bean-shaped organs, and if you locate your rib cage, they actually hang out right behind after they end right there. The kidneys function include making urine, removing waste products from the body, maintaining a water balance. So the kidneys are kind of like our sensors. They can feel if we have too much fluid in our body. It tells us, hey, there's too much fluid, let's get rid of it, let's make urine. But if we're dehydrated, it also senses that as well and says, hey, we don't need to get rid of this, let's keep this water for ourselves. It also regulates the body's salt and mineral content, so sodium, potassium, calcium, anything like that. It keeps a good balance, because if it doesn't, we can feel it in our body and our muscles start to get crampy, so our kidneys help with that as well. It also produces hormones that help control your blood pressure, produce red blood cells, and maintain healthy bones. So how do the kidneys actually work? So we think of them as two big filters, but actually they house more than 1 million little filters. So if you see right here the nephron, use this pointer. The nephron is actually kind of like the factory. More than 1 million of these little factories have this filter right here called the glomerulus. And then I have a zoomed in picture right below here. So the glomerulus is actually the filter. I don't know if you've heard of a GFR, or glomerular filtration rate. Later we'll talk about that, that's actually what the doctor looks at to see if your kidney is functioning appropriately or not. So if you see here, kind of like a colander, it has little holes. It allows little things to go through, little molecules. But things like protein and red blood cells, they have to stay in our blood. And I'll get to that in a little bit. Oops, sorry. So what is chronic kidney disease? So chronic kidney disease is progressive and irreversible reduction in your kidney function. So as we age naturally, our kidney function starts to decline. But there's other things that can expedite that process, and so we're here to talk to you about how not to, get that process going too fast. So 30 million Americans right now have CKD, and millions or others are at risk as well. So how do you get tested for kidney disease? So there are two main ways, and they're very easy actually. So if you go to the doctor's office and to your physical, you can get your urine checked and you can get your blood checked. So what the doctor looks for in your urine is checking for protein, because normally we shouldn't have any protein in our urine. Now sometimes we eat too much, so a little bit slides through and that's okay. But naturally we do not want protein in our urine. So if we think back to that picture of the glomerulus, it actually has like a, let me just point right here, it's easier. So it actually has this filter right here, this purple dot right here, the plasma protein, we don't want that to go through. If this gets too big, this indicates that there's damage to the kidney and the protein will escape and get to our urine, and we don't want that. Another way is checking your blood. So there is something called creatinine in your blood, and this estimates your kidney function and your glomerular filtration rate. Again, back to that filter, that glomerulus, if your filtration rate is high, that means your kidney function is pretty good. But if it's low, it maybe indicates that your kidney function is not working the best so that it could be. So important just to really ask your doctor if they're not, getting that blood test or that urine sample, to just get it done part of your yearly physical, okay? So what causes CKD, which is chronic kidney disease? So there's three main things that can make you prone to having kidney disease, and this includes if your diabetes or your high blood pressure is not managed well. Anything that's uncontrolled like that puts a lot of pressure on your kidneys, and then that can cause damage in the long run. And then what we're here to talk to you about today is the medication aspect. So there are over-the-counter pain medications that these are very common that you can just grab off the shelf and use for anything for pain. So Advil is also known for ibuprofen, Aleve is also known as naproxen, and we have aspirin, and we also have Tylenol. So in this red box specifically, we house a group of the same family. They're called NSAIDs. These specifically are the medications that can affect your kidney and cause that kidney damage. Whereas Tylenol, also known as acetaminophen, can cause liver damage if used incorrectly. Okay, so what does NSAID stand for? NSAID stands for non-steroidal anti-inflammatory drug. So this medication is used for a lot of purposes. So mainly we use it for pain. So if I have a headache, I'll take some ibuprofen. If I accidentally rolled my ankle and it's swollen, I'll take some ibuprofen. People also use it for fever as well. So specifically, how do NSAIDs actually cause the kidney damage? So I have like a simple picture to demonstrate first. So we have the hose here. Naturally, if it's not constricted or anything is blocking it, the water will go through to the other end on the nozzle end. But if I grab the hose and I, constrict it and, hold where no water can go through, nothing will get through to the other side. So that's the same way as what NSAIDs do to your kidney. So here we have the afferent arteriole, which is just the blood vessel that goes into the kidney. NSAIDs work on that arteriole and just constrict it, just like how the hand is on the hose, and doesn't allow anything to get through to the kidney, which leads to your kidney being dehydrated, and that's the way it can get injured. So then what happens is, this is again our filter picture, the glomerulus. The filtration will go down, which will indicate to the doctor, hey, this person's kidney function is not the best. Let's look into it and see what's causing it. So naturally, how to fix this is if we don't give the person the NSAID anymore and we get rid of it, your kidney function gets better. And we give some water, like IV fluids, and it'll be okay. So now Olivia is going to talk to you about how to read a label. Thank you.
All right, so now that we've talked about how your kidneys can become damaged, we thought it was important to show you a label of a bottle and make sure that you know how to read it appropriately and find the correct information. So this is an ibuprofen label. This is usually wrapped around the bottle, but this is laid out for you. There are two sections that we want to highlight for you. The first is the active ingredient section. So this section is, all of these sections are always going to be on the bottle, but this is one that's important. So specifically for this bottle, it shows that it's ibuprofen. It also tells you the strength of the medication, and that's per tablet. So here we have ibuprofen, 200 milligrams per tablet. Now, this is a good place to look if you maybe find any over-the-counter other medications that you maybe use for headache or anything, that it'll list all of the ingredients that are in the medication too. So this is a good place to check what's actually in your medication. The second section is the directions section. This tells you exactly how to take the medication. So for example, this one says take 1 tablet every 4 to 6 hours while you have symptoms, and make sure that you're using the smallest effective dose to treat your pain. So that's another very important section that you can always go to look to see how to take the medication. So this is a table that kind of outlines the medications that Angie had talked about, listing ibuprofen, naproxen, aspirin, and Tylenol. It goes through what the brand names for these medications are, what they can be used for, as well as normal dosing of the medications. There are some specific sections that we want to touch on. So first, again, highlighting what is an NSAID and what is not considered an NSAID. So all of these except for the acetaminophen or Tylenol are considered NSAID medications, and those are the ones that we are focusing on in this presentation. Sure. Then the next section is the maximum dose section that we want to highlight. So even though these are over-the-counter medications, people often will think that these, are safe, but there are some limitations in how you should take these medications, even though they are still over-the-counter. So for example, under the ibuprofen section, it has the maximum dose is 6 tablets a day, or 1,200 milligrams per day. So if you look at the directions for it, they say you should take 1 to 2 tablets every 4 to 6 hours as needed. So some people may be using maybe 3 to 4 tablets at a time. So it's, if you think about it, you're using half or even more of your daily allotted dose. So it's just important to keep these maximum daily doses in mind, and making sure you're using these medications in moderation.
I do have a quick question.
Sure.
On the label. Will the label always say the medication is an NSAID?
It should, yeah. Mm-hmm.
Okay.
Did everyone hear that question?
Okay. All right, so overall, just some general considerations when you're thinking of treating your pain with some over-the-counter medications. So specifically avoiding NSAIDs if you already have kidney disease. or if you take any high blood pressure medications or have been diagnosed with high blood pressure, if you use these too frequently, these medications can actually increase your blood pressure. Also taking the smallest effective dose of the medication for the shortest amount of time. So these medications are okay just as long as you're using them appropriately and using the smallest effective dose that you can, using them in moderation. And then also you can try alternating doses of NSAIDs. So if you don't want to use as much, you can try taking an NSAID at one point, like ibuprofen, and then alternating that with doses of Tylenol. And that'll also minimize your risk and maximize the benefit that you'll get from those pain medications. If you ever have, sorry. It stays the same. Mm-hmm. Oh yeah. So the question was, what would be the highest dose of NSAID that you could take in a day if you were alternating with Tylenol? And it would stay the same as what the overall daily allotted amount was. Oh, and if you have any questions ever about treating pain, as far as using over-the-counter medications, you can always talk to the pharmacist at your local pharmacy, as well as bring it up and talk to your doctor about it too. So we kind of touched on the over-the-counter medications, specifically those NSAID medications that can affect your kidney. And now we just want to touch a little bit about the other conditions that we had briefly went over. So diabetes and high blood pressure and how those can cause kidney damage, and maybe some pearls about choosing over-the-counter medications specific for these conditions as well. So over time, if you have a very high blood glucose level and high blood pressure, that can cause damage to those same blood vessels that Angie was talking about with those NSAIDs. So the blood vessels can narrow and get clogged, and that leads to less blood getting to your kidneys and overall decreasing function. So if you think about the hose again too, it's working on those blood vessels and decreasing blood flow to your kidneys. So some things to keep in mind if you're buying over-the-counter medications. One, if you have high blood pressure, there are some medications that can increase your blood pressure. For example, some common decongestants that you find in cold medications like pseudoephedrine or Sudafed or phenylephrine, these things can raise your blood pressure. So being aware of that, commonly these cold medications come with multiple ingredients in them. So making sure again that you're reading the label to know what's exactly in it. Also, some may be pain medications, they're combination medications, and they may contain caffeine. Caffeine can also increase your blood pressure as well. Just again, it's always important to read the label to make sure you know what you're taking. There are some alternative medications that specifically you can use if you have high blood pressure. I know there's like HBP Coricidin or those, they stand for like high blood pressure. So there are medications that are specific that can be taken by patients who have high blood pressure. But again, if you ever have any questions, making sure you ask your pharmacist or your doctor about what you can take. And then as far as for diabetes and thinking of over-the-counter medications, if you're using any liquid medications or any like syrups, those oftentimes have a lot of sugar in them, and that's to make the medication taste better. And it won't necessarily say sugar right on the ingredient list. It may say like artificial sweeteners, or like this label says high fructose corn syrup. So it's just important to read those labels before you're taking those medications, or try to use a tablet or a pill form rather than using a liquid form. So just some general ways to keep your kidneys healthy, making sure you're eating a low salt diet, getting enough water each day. That'll help keep your kidneys like filtering and blood flowing through your kidneys, making sure you're exercising, limiting alcohol, and using your NSAID medications in moderation. And then lastly, when you go to your yearly physical, it's just important to make sure that you're checking that, your kidney function. And then I think we've touched on this a lot, but if you have any questions about anything in general about your medications or about how to use NSAIDs or look at a label, you can always ask your doctor, or there's pharmacists at your local pharmacy like your CVS, Walgreens, Pick and Save, and they're all free medication resources for you. And then lastly, if you have any medications that you no longer want to use or have expired, just going over some safe medication disposal practices. So the one main thing is to make sure you're not flushing those medications down the toilet or any drains. There are multiple ways that you can dispose of those medications. One being we have drug take back day events, specifically on October 27th. The Concordia School of Pharmacy in Mequon, as well as Ozaki Transit Center in Port Washington, will take back medications. You just drive up, drop off your medications, and we'll take them for you. Also, local police and fire departments take medications back, and some local pharmacies do as well. Not all pharmacies, so it's important to call them ahead of time just to make sure. And then we also have linked some websites that you can check out to find a location near you. And lastly, if you have any questions about kidney disease, kidney health, also looking at, the Kidney Foundation has so many different resources. So they have a great website that you can look at, as well as they have this phone number and email if you have any other questions too. So feel free to reach out to them as well. So we have some questions just to test how we did as presenters, I guess. So if you want to raise your hand or answer a question, that would be great. So first, who will you ask if you need help picking out the right medication for you?
Might have to come and steal their popcorn.
Not all at once, guys. Oh, so who will, I got this.
Sorry.
It's okay. So who will you ask if you need help picking out the right medication for you? Yep, your doctor and also pharmacist. Your pharmacist at Target, CVS Pharmacy, Walgreens, they're very, very helpful, and they're more than willing to answer any of your questions. And they're a free resource. So, just walk up to them and say, hey, is this the right medication for me? Because I'm not sure. And they'll be more than willing to help answer that for you. So what are some factors that put you more at risk for getting kidney disease? So these are 3 things that we hit on kind of throughout the presentation that put you more at risk for getting kidney damage. Go ahead.
Diabetes.
Okay.
And high blood pressure.
Perfect. What's the third one? Perfect. Yeah, exactly. Perfect. How do you test for kidney damage or kidney disease? So there were 2 ways that we talked about. Exactly, your urine or your blood. Perfect. So lastly, are NSAIDs safe to use?
Yes.
Who said that?
Yes.
Yes. Someone else said within reason. Who said that? Good job. That's right, exactly. I know go ahead.
So if you're taking medication for high blood pressure,
Yeah.
you are to avoid the NSAID because it may increase your blood pressure.
Okay, so let me just repeat that question really quick. So the question was, if someone has high blood pressure, they're supposed to avoid NSAID use because it might increase their blood pressure. So the answer to that is no, it doesn't apply to everybody. So this is the part where the doctor comes in and really sees, is the NSAID correct for you? Because there's a lot of people that have high blood pressure, and if you take an ibuprofen once in a while for a headache, you'll be fine. But if you have to take ibuprofen for chronic pain use, then that's something that the doctor has to evaluate for you.
Including the 80 milligrams?
80 milligrams?
80 milligrams.
Oh, aspirin. Sorry, yeah. Okay, aspirin. Go ahead. I'm going to have to ask Dr. Gurubian on this one.
So this is the kind of question that I get a lot is,
Do you want to maybe step up
Yeah.
to the mic just so that I'm people?
So this is a question that I receive a lot from patients regarding baby aspirin. Because a lot of times doctors tell you to take baby aspirin and you're supposed to take it on a daily basis for an indefinite time period. And is this safe doing it, taking it for such for a chronic indication, if you're taking it for such a long period of time? And the answer is that with the low amount of aspirin in baby aspirin, it is safe for your kidneys. So the one that we're most concerned about is the the aspirin that's made for pain relief. So this is going to be a higher strength of aspirin. And so that's the aspirin that you want to avoid taking on a chronic basis. But with a baby aspirin, it's such a small dose that it does not have the constricting effect on your kidney. So it does not have the same consequences that we would expect with the NSAIDs that are used for pain relief.
So if you stop taking the medication, the aspirin, the three.
The 325 milligram aspirin, that's for pain relief, yes.
So if you stop taking it, eventually the kidneys will.
So remember,
Healing itself.
So I think Angie and Olivia touched on this. So once chronic kidney disease develops, it is irreversible. So that is why we want to make sure that we don't allow the disease to progress. So once you do any kind of damage to your kidneys, it is almost entirely lost. And so there's no going back. So that is why you want to make sure that you do everything you can to prevent any kind of kidney damage from occurring in the first place. Yes.
What are the different stages of kidney disease?
I'll let them handle it.
So,
Also a good question if you didn't grab it. Go ahead.
so the question is, what are the different stages of kidney disease? And we actually have a slide on this. So there's 5 different stages, and again, it's based on your glomerular filtration rate. So how fast is the kidney filtering the proteins or the blood through the kidney? So stage 1, and it's actually in your slide 2, so you'll have this for reference as well. So stage 1 is usually like 90% or 90, or higher, which then it tells you that I have really good 90 to 100% of my kidney functioning properly. Once we get to stage 2 and progress all the way down to stage 4 and 5, that's when you get to kidney failure. So we try to make sure to prevent any damage from occurring before getting to those further stages. Does that answer your question?
But you said, like, say somebody would have stage 2.
Yeah,
Is there something they can do to prevent it from getting to stage 4 and 5?
exactly. So there are medications. So once you get diagnosed and the doctor, for example, notices, hey, this person's filtration rate is slowing down, then the doctor will put you on certain medications that can prevent further kidney damage from happening. So yes, there is.
What medication is that?
This is okay to answer.
So do you want to repeat the question?
Oh, so what medications can prevent chronic kidney disease from getting worse?
So this really all depends on what the cause of chronic kidney disease is. So if it's diabetes, if it's high blood pressure, you want to be put on medications that control those 2 diseases to prevent those diseases from having an effect on the kidneys.
But what if you don't? What if you don't have diabetes or high blood pressure, but you have stage 2 kidney disease and you don't want it to go further? Is there a medicine you can take to prevent it from going further?
So there are other types of causes of chronic kidney disease, and most of those are inherited or genetic causes, so those you don't really have control over. But some of the things that, in terms of controlling your high blood pressure and diabetes, Olivia and Angie touched on some non-medication ways you can use to help control or prevent from the chronic kidney disease from advancing, and those are things like controlling how much salt you eat in your diet, just to make sure that you don't increase your blood pressure, which leads to the chronic kidney disease from developing.
So if I could, I don't.
Yeah. Yes. Go ahead.
And again, you guys are experts, but again, we get a lot of calls in our office about that because, well, first of all of our parts are never going to be at 100% because every year, different things are working. So it is normal for your kidneys to not be, at 100% if you're 50 years old, if that makes sense. But your question relates more to lifestyle, as Catherine was saying. So if you don't have diabetes, high blood pressure, or some of those genetic kinds of things. So Your doctor is going to probably say it's the things that involve healthy, kind of heart healthy living. So, you know, you're going to hear, if you're smoking, quit. If you're kind of putting on, you know, those 10 or 20 pounds, you're going to hear you should exercise. Definitely if you're overweight, but heart healthy diet. But again, that's where asking your physician, especially if you don't have those other conditions, let's just say you're a regular person, etc. But there are other things that cause kidney damage also that I was going to ask you about, in terms of sometimes people's kidneys are injured because they might have a diagnostic procedure. And so, for instance, the dye that was used for another type of procedure in terms of an examination might have, depending on how that person's body reacted to that dye in terms of that diagnostic procedure, that might cause the kidneys to be damaged. And again, once kidneys are damaged, those little garden hoses that Angie, I love that illustration. Once they're damaged, you know, you can't kind of repair those garden hoses. So what you have to do is just maintain things that are healthy and good. I don't know if you guys would agree with kind of that. But that did, if I can jump off on your question, I wanted to ask, because one of the things that I didn't see covered that, again, people call our office about is they might go for a dental procedure. And so then that dentist might be prescribing some pain medication. So do you have any kind of advice about maybe what I should do as the person, the patient, if you will, to kind of keep that all mindful? Should I tell my dentist what I'm taking in terms of the medications? What would you suggest?
So the recommendation I would make is that you need to have an open dialogue with not only your dentist, but with your physician, saying to make sure that everybody's on the same page in terms of what is going on with the health procedures that entail. So if your dentist is planning on prescribing you or asking you to take some pain medications, you want to make sure that you let your doctor know, your physician know that your dentist is prescribing this, to make sure that they can run through your medical record to make sure that it does not interact or interfere with any medications that you're currently taking, or if you currently have kidney disease, to make sure that it does not make it worse. So you need to make sure that you have that open dialogue with all your healthcare providers, and make sure that that they are all well informed of your medical history.
I'm going to ask Angie or Olivia this question. It's cold and flu season, so tell me about that. You talked about, you know, the stuff I'm going to pull off the shelf, but if I go down a different aisle at my pharmacy, I might pull off some cold and flu medicine. But what if I'm taking high blood pressure medicine or something? Who should I ask? What should I do?
Okay. Oh, what was that? Oh, repeat the question. So the question was, if someone has high blood pressure, for example, and it's cold and flu season, so they have a runny nose or stuffy nose and are coughing, have congestion, who do they ask if they need help? And she keeps pulling stuff off of the shelf. So what are we going to do? So she should come up to the pharmacist. Honestly, the best option is to go to the pharmacy that you fill at, because the pharmacist has then all your medications in that computer system, and can run a drug-drug interaction to make sure that this is safe for you. They can take a look at your other disease states and make sure, just besides just high blood pressure, maybe this medication will affect something else. So it's really important to just, ask your pharmacist any questions you have. And again, it's just best to, kind of like what Dr. Garibian said, make sure that all your healthcare providers are aware of what you're taking and what your past medical history is. So another thing you can do is fill at the same pharmacy. Many people, for convenience, can fill sometimes here, you know, at this pharmacy, but then fill at another pharmacy at a different time. So those pharmacies don't keep track unless they're in the same system, unless it's all Walgreens, and that's okay. But if you're filling at a Walgreens and a CVS and a Pick and Save, those computer systems don't connect, unfortunately. So then there's a gap, and we don't know what medications you're taking, so things can interact. So if you just keep everything in one spot and ask your pharmacist, that's really the safest option.
I think that part of the question she asked is if you were at a grocery store, because what came in my mind is 2 o'clock in the morning and you're dying. You send your wife out to the gas station to get you overpriced stuff there. There's no pharmacist there.
That's a good question. I was thinking maybe Pick and Save when they have a pharmacist. I wasn't thinking 2 in the morning. Okay. How would you like to answer the question?
Well, if it's an emergency and you need some pain relief immediately, you can go ahead and take that dose immediately to get that immediate pain relief. And then the following day, when there is a pharmacist or another healthcare provider, I would contact them to say, is this okay for me to take? Remember, the one thing that we're really most concerned about is not that one-time exposure to these medications. It's that chronic use of these NSAIDs that has the most impact on your kidneys. So that's the thing you want to avoid.
Go ahead.
There are some all-night pharmacies that are
And actually, it's a really good point. She mentioned that there are 24-hour pharmacies, so you can always call, and you can always check on the website too, and it'll say Walgreens 24 hours, and you can pick up the phone. You don't even have to like go if you already, that's too far for you and you already picked it up from that grocery store or gas station. Just give them a call and they can answer that for you.
I have one more question.
Go ahead.
You mentioned water.
Yeah.
What does water do to help your kidneys, and how much water are you talking about?
So the question was, what does water do for your kidneys? Sorry, what was the second part of that question?
And
How much?
And how much, sorry. And how much water is good for you? So to answer your question, water is really good for your kidneys in terms of hydrating your kidneys. So if you think about our kidneys, they're kind of our filtering machines that everything goes through. There are like purifiers, if you can think about them that way. So if we are just filtering all this salt and all this stuff that we're eating without drinking water, sometimes things can get stuck in our kidneys and they need just a little push to move them through. Kind of, if you're thinking, like, I'm trying to get a visual here. So if you're so nothing can get past. So if you get that, you're eating a lot of salt and pickles and everything, drink a lot of water because that'll help flush your kidneys. Because you don't want to get like a kidney stone, because that's how kidney stones form. Unless you have like a genetic disorder, like we talked about earlier. A lot of kidney stones is because you're not drinking enough water. You're not getting those kidneys hydrated enough.
And how much?
Oh, and how much? I keep forgetting that question. I'm sorry. So how much is like those 8 glasses a day? I mean, if you can't have 8 cups of water a day, just drink to your comfort. A lot of people actually, if you monitor yourself, a lot of people don't drink as much water as they think they do. So really, you try to drink as much water as you can and try to increase one thing at a time, because you can't just drink, if you only drink a cup of water a day, for example, right now, you can't go from 1 to 8 right away. It'll make you feel sick. So you just have to work your way up to that level eventually. Mm-hmm.
I also recommend, with regards to how much water is enough, everybody has a thirst mechanism in their bodies. So I don't necessarily like to say that everybody should drink 8 glasses of water every day, because that water can come from the food that you eat. So you eat soups, or if you eat fruits that are mostly water, that counts towards the 8 glasses of water. So I usually like to say for most healthy patients, or for most patients in general, just play it by ear. If you're thirsty, if you're feeling thirsty, that is a good indicator that you are dehydrated and that you should increase your water intake. So I would rely just on what your body says to you. So.
Americans drink a lot of soda these days. What does that do to kidneys? And is it a substitute for water?
So,
it's not a substitute for water. So the question was, I can't even repeat it. Go ahead. I don't even remember the question.
So the question was that a lot of Americans drink a lot of soda water or soda. So what does that do to the kidneys? Does that contribute to the water that we need?
So soda is not kidneys, or soda is not water at all. So soda actually has a lot of sodium and possibly potassium and sugar. And so it kind of actually could dehydrate you more than hydrate you. If that makes sense.
Remember, soda has a lot of caffeine in it as well, and so caffeine is it's what's termed as a diuretic. So it actually increases how much you urinate. And so this actually has the opposite effect. So you may be ingesting water immediately, but it actually doesn't stay in your body because it causes you to urinate it. And so it doesn't not help with in terms of keeping your kidneys healthy.
Oh, and then, go ahead.
And this is getting back to the GFR. What is the difference in the African American, with the numbers compared to other races? Is it higher or lower? What is kind of like the norm for African Americans?
Okay. So the question was, in terms of the GFR, how does it differ between races, specifically African American population? I don't know that question off the top of my head. Do you know that? We'd have to research that.
I don't know the statistic for the differentiation between the different races for who develops these different stages of chronic kidney disease. I don't know if Cindy, you know.
So I can help with that a little bit.
Perfect.
So GFR is really a mathematical calculation. So the laboratory, this has been, so on the bottom of your lab report, you'll see GFR, and typically it will say Caucasian, non-Caucasian, and depending on what lab is running your blood test, it might have African Americans. But scientists are the ones that developed this mathematical formula. So in the 90s, it was just kind of they would use creatinine. So those of you that might be over 29 might remember from your lab reports, it would be my creatinine is 1.2 or whatever. And so over the years through research by scientists discovered that by applying this mathematical formula, but looking at results from all races, there is a factor mathematically built in. So when your blood is calculated and you're identified and you've identified yourself in a particular race, that mathematical formula is how it's calculated. So what is on your lab report and what's on my lab report will be calculated, and one of the factors based on the math that's put into that computer, that's been based on all of their research over the years and millions of medical records. So whatever's on your lab report is right for you, and the numbers have been adjusted based on the race, but there's really no magic. But in terms of kidney failure, African Americans are typically 3 times more likely than Caucasians to develop kidney failure. So that's just kind of about us overall. I don't know if that helps a little bit. So GFR is just, so some people think, well, I don't have extra money, I can't get that test. It's not a test. So you might want to take that GFR, and I think it explains it just a little bit better in there, but it's truly a mathematical calculation. So it doesn't cost you anymore, but it's actually more specific. So the garden hose Angie had on her slide, all those little filters in there, that's what that GFR, glomerular filtration rate. How are the little glomeruli? So kind of the analogy I use is kind of like a tea bag. So how are those filters filtering, if you will? Did that help a little bit?
Question.
Is there, like, say somebody has arthritis, is there one of those NSAIDs or whatever that would be better for use in that kind of a situation?
The question was, if someone has arthritis, is there a better NSAID for that particular person compared to the rest?
Or whether it be Tylenol or Aleve
Or just a better pain medication overall that might not be an NSAID?
Inflammation.
Okay. Get this value.
So remember that NSAID is spelled NSAID. So the I stands for inflammatory and the A stands for anti. So it's anti-inflammatory. Tylenol is not an NSAID, so it does not have any of that anti-inflammatory actions on the body. So you can take Tylenol, but it depends on what type of pain, and it won't have any effect on relieving any of that inflammation in your body. In terms of which one is better, again, it really depends on the individual. If somebody already has like stage 3 chronic kidney disease, I would be hesitant to recommend an NSAID to that patient. Instead, I would recommend, say maybe there are some topical creams that you can use and apply to, if there's a certain spot or a certain sore area that you want to use, you can apply it just straight to that area, and that can help relieve some of that inflammation and some of the pain without getting into your body and causing some injury to your kidneys. Yes.
Concerning using herbs to keeping your kidneys healthy, what is your thought?
So the question was, in terms of herbal medication and dietary supplements, are there anything that's over the counter besides pain medication specifically to help relieve someone's pain? This one's tricky. This one's a tricky question, to be honest, because dietary supplements and things that are not like FDA approved they don't have a lot of research behind them. So it's hard for us to say, hey, take this medication for pain. So we can really only recommend the ones that we know actually work and how safe they are. Because a lot of those medications, we don't know if they're truly safe. Does that answer your question? Okay, go ahead.
Where does like extra strength, Excedrin, where would that fall? Is that
So the question is, where does extra strength Excedrin fall? Is it an NSAID or is it like Tylenol? It would be in the NSAID family. Mm-hmm.
So I would read the label and make sure, because there's different types of active ingredients and then different types of products. Certain labels of Excedrin actually have Tylenol in it, and they're a combination of Tylenol and caffeine. And so I would make sure that you read the back of the label and make sure that it does not say that there's an NSAID in the product.
Just another question. The urine test, I haven't been to a doctor in years that's required that. It's usually just a blood test. I mean, so you specifically need to ask for a urine test? What you're recommending?
So the question was, if you go to your yearly physical and the doctor's only doing a blood test, should I ask for a urine test? So the urine test or the blood test are okay because they're testing for the same thing. But the urine test is just more specific to the kidneys compared to the blood test, because sometimes the doctor is not going to run everything through with the blood test, because if you come with certain symptoms, the doctor might like hone in only on a specific thing. Or if you're going in for a physical, they might do something broad. So it's really important to like pay attention to what the results are and what did the doctor test you for? Did they test you for kidney disease? So you can definitely ask for a urinalysis, no problem.
And remember, the thing that the urine test actually tests for is for protein in your urine. And as Angie and Olivia covered, that protein should normally not be found in the urine. And so if your doctor runs a urine test and they find protein in it, that's an indication that there may be something wrong with your kidneys. And what the blood test does is it confirms whether it is due to your kidneys being injured or if it's some other cause. So you need both of those two tests together to actually make a diagnosis of kidney disease.
Could you explain how too much Tylenol can affect your liver?
So the question is how much Tylenol causes liver disease, correct? Okay. So this is a hard question. This is all you.
So did you ask how much or how?
Well, explain the effects of how too much could damage your liver. Tylenol, just like NSAIDs, NSAIDs cause kidney disease if you take too much of it. And likewise, I don't know the exact
what it exactly does to the kidneys, or the physiological process of how that causes or leads to liver injury. There's a lot of specific actions that I don't think is necessary to really delve into at this point. But similar to NSAIDs, if you take Tylenol on a chronic basis, and specifically if you take too much of it or exceed the dose, the recommended maximum dose of 4,000 milligrams, as was covered in the slides, then you increase your chances of developing some harm to your kidneys or to your liver. And so the magic number here is at 4,000 milligrams or 4 grams per day. And a lot of times you can find these this acetaminophen, this Tylenol, in numerous different products. So it's not just Tylenol. You'll find it in a lot of the prescription strength pain relievers. They're in combination with some of the opioids that your doctor may prescribe for stronger pain relievers, and things like Excedrin that contains Tylenol. And so if you start taking these different medications without knowing that they all contain Tylenol, you can easily exceed the maximum recommended amount of the Tylenol or the acetaminophen, and without knowing, cause some harm to your liver. Question in the back.
It seems to say that high blood pressure causes kidney disease, or vice versa. Kidney disease, like high blood pressure, it's caused. The high blood pressure is caused by the kidney disease. By the same token.
Okay, is the question is it high blood pressure causing the kidney damage, or the kidney damage causing high blood pressure?
I think she's asking about
It says both.
Both. So it's both. So it could be both ways. Yeah, correct. But having high blood pressure puts that extra pressure on your kidneys, so then it just increases your chances of getting chronic kidney disease, is what that is. And if you have kidney damage and you didn't have high blood pressure, for example, then that can eventually lead, because your kidneys regulate your blood pressure as well. So if your kidneys are damaged, it's kind of another thing, that your blood pressure is not regulated properly. So they both work together. Mm-hmm. You're welcome. What other questions do you guys have? I mean, we could stay here
Any
for
questions
one-on-one
online?
questions, yeah.
No?
Okay, well, I think they did an awesome job, don't you? Yeah. Well, for those of you that are in the room, if you'll take a few moments to give Angie and Olivia some of your feedback on the evaluation form, and you can either leave those on the table or drop them off on my chair that's over there. You're certainly welcome as we conclude this event to perhaps our speakers would stay around, and our super duper expert would stay around a few moments if you do have maybe an individual question. For those of you that joined us online, we'll be sending you a survey online if you'll give us that feedback. I want to thank you all for participating, and thank you again for taking time to learn about your kidney health tonight. Have a great evening.